Today I'll be talking about managing asthma for improved absenteeism. As a pediatrician in the Bronx, I understand the critical role that educators play in the lives of our students, and I'm here to share some valuable insight on the fundamentals of asthma and its impact on student absenteeism, along with the effects of asthma management techniques for students and schools. Asthma is a chronic respiratory disease characterized by inflammation and narrowing of the airways, which can lead to wheezing, difficulty breathing, chest tightness, and coughing. These episodes are mainly due to air obstruction in the lung that can be resolved on its own or in response to treatment. Unfortunately, asthma is disproportionately affected those residing in high poverty neighborhoods, and our children in the Bronx have the highest rates of asthma compared to the rest of New York City. And this is mainly because many of our families live in poorly maintained housing, which may expose our children to asthma triggers such as pests, dust, mold, and smoking. These environmental triggers can increase the frequency and severity of asthma symptoms and exacerbations. In addition, many of our children are more likely to seek care in emergency rooms where their asthma episodes are treated, but controller medications for the management of asthma and preventing further episodes may not be prescribed. All these issues are what our children are facing, which are leading them to poorly manage asthma, resulting in more frequent and severe attacks, leading to more absenteeism. Proper asthma management can help mitigate these challenges and improve attendance. There are some effective asthma management techniques for students and schools. Early identification is important, so educators should be trained to recognize asthma symptoms in students, which include coughing, wheezing, or chest tightness. We know that about 60,000 children attending public schools grades K through 8 in New York City have active asthma. In the Bronx public school, we know that there's a higher percentage of children with active asthma compared to the rest of New York City. And among these children with asthma, only 36% of Bronx public school children have a completed asthma medication administration form, compared to almost 50% of the other public schools in New York City boroughs combined. Asthma Action Plan and Medical Administration Forms, also known as MAFs, are completed by the medical provider and must be renewed every year to help confirm the child's asthma diagnosis, medication, and MAFs are also required for school nurses to administer medication in an event of an acute asthma exacerbation. Without a current MAF on file, nurses legally are not permitted to administer asthma medications. So, MAFs are a key to successful school management of acute asthma exacerbation in children and could contribute to potentially avoidable asthma-related ED visit. Another important factor is environmental control. As mentioned, identifying and minimizing asthma triggers in school and in home, such as dust, mold, and allergens, are important to control exacerbations. Luckily, we have a great program called New York City Healthy Neighborhoods Program, which is a home assessment for asthma triggers. And the student's healthcare provider can provide a referral to this program, which reduces indoor allergens and pests in the homes of patients with asthma. Physical activity is also something we encourage. Encouraging physical activity among students with asthma is part of a healthy lifestyle. So yes, children with asthma can participate in physical activity, but it's very important to ensure that they have their inhalers readily available during exercise. Another very important component is to check with your schools to have a clear emergency response procedure in place. First, it's important for the staff to be trained to recognize the student's asthma symptoms, as I mentioned, but more importantly, when these symptoms are severe and require immediate action. It's important to know the steps to take in case of a severe asthma attack, including having the child go to the nursing station or have self-administration of rescue medication and calling 911 if necessary. So, in summary, managing asthma in the Bronx requires a collective effort from teachers, healthcare providers, and parents. It's crucial for educators to recognize the asthma symptoms promptly, implement effective emergency response procedures, and encourage parents to initiate discussion with the healthcare providers to develop an asthma action plan for their children. Together, we can help children with asthma lead healthier lives. Thank you for your attention and the dedication of the well-being of our students.